First in the news, the foreigner who tested positive of the deadly Middle East Respiratory Syndrome coronavirus or MERS-Cov may now be discharged from the hospital. Victor Cosare will tell us why.
After days of isolation and treatment at the Research Institute for Tropical Medicine or RITM, the foreign national who was previously tested positive of the Middle East Respiratory Syndrome coronavirus or MERS-Cov can now be discharged from the hospital. This after the 36-year-old patient was found to be already free of the virus after 2 separate tests were conducted.
The 36-year-old foreigner who was tested positive of MERS-Cov or your Middle East Respiratory Syndrome coronavirus is now free of the virus after yielding 2 negative results. 2 negative tests 48 hours apart, you can safely say that the patient is already clear or free of the virus, free of virus.
There is no longer any virus, he's no longer infectious to anyone else. But just to reiterate, he has been very cooperative, very compliant, very patient, and has now fortunately is quite a lot better than he was before.
It was on July 2 that the patient showed symptoms of MERS-Cov infection, which is having fever with cough. The patient was taken to the RITM last July 4 for proper medical attention. Meanwhile, the 32-year-old female who had a close contact with the foreign national will still remain in the RITM until the 14-day quarantine period ends on July 18. She is not, however, showing any signs of infection.
Now, she's good. She's doing good.
The health department was also able to trace and is now doing a daily monitoring through its regional epidemiology surveillance unit the 112 individuals who also had contact with the male patient. DOH clarified that even if the foreign national has already recovered from the infection, they still cannot say for the moment that the Philippines is MERS-Cov free, not until the 14-day observation period of those individuals who had contact with the patient is over. However, the health department stressed that the 112 individuals are also not showing any signs of infection so far. The department is again reiterating its call to those who came from MERS-Cov infected countries to immediately visit the hospital if they are experiencing flu, fever with cough, cold, sneezing, and diarrhea, and also to honestly and completely fill out the health declaration checklist.
Kaya nating panatiling ligtas ang ating bansa kung lahat tayo gagampanan ang ating papel. Sama-sama natin supuin ang MERS-Cov garing concluded.
To those who need assistance or additional information about MERS-Cov, they may coordinate with the DOH through their hotline numbers. Victor Cosare reporting for Y News.